Good afternoon, esteemed judges and my dear friends. Today I'll be speaking on some interesting insights into research that we've done at our institute. I have no financial disclosures. Well, 101 million diabetics are there in our country today, and at least 21 million of them already have vision-threatening diabetic retinopathy. So we are on the lookout for a very definitive treatment for our patients. We already know that vitreous biomarkers can not only predict disease, but it can also tell us the best treatment available for our patients. But sampling the vitreous is a little difficult. It's almost a surgical procedure, and we have tears, and we also have aqueous which we can collect at the time of the first injection, and blood. Every diabetic checks for their blood sugars. So that came about with this bright idea where we wanted to compare these 4 samples in the VAST study. We wanted to see if the biomarkers correlate between these 4 and how strongly do they correlate. 22 patients who were undergoing diabetic vitrectomy were recruited for this study, and all 4 samples were collected on the same day as the surgery. This was briefly how we did the study. Once they were collected, they were stored, they were segregated, and then extracted for further analyzing. We used different quantifiers, but we finally managed to get the absolute concentration in all 4 of them. As you can see here, the protein concentration was the highest in plasma, but we used something called as normalization to make all of them comparable. And if you see here, the ocular fluids biomarkers kind of group together. That's important because it probably tells us that organ-specific sampling is more reliable. Now coming to this is a very interesting cluster. If you see in cluster 2, it's called as hierarchical clustering, where we've seen these biomarkers coming together, which are both vasculogenic and inflammatory. So that means across the different 4 samples, they correlated very well. Overall, out of the 53 that we tested, 48 of them were positively correlating, and we found 80%, please remember 80% correlation between vitreous and aqueous, and also 28% between the 4 samples. This is a very busy Sankey plot. This is basically a complex interplay between the sample combinations and the sources. And the red arrows are the ones that are very important. We already know the usual suspects of VEGF and angiopoietin 2, but then we also saw a whole lot of other inflammatory biomarkers here, which could potentially be drug targets in the near future. Yes, we found it difficult to collect all 4 samples from a single patient on a single day across different disease spectrums, and we must remember that systemic variations will have a bearing. But then repetitive testing is possible, and sure enough, we will be able to find patient-specific therapeutic targets very soon. Well, this is the first study that has compared 4 different samples from a same patient, and also particularly in diabetics. We found the strongest correlation between vitreous and aqueous. We also found a reasonable correlation with tears because of extraocular spillover. We saw that organ-specific sampling may have definitely more clinical relevance, but friends, surrogate sampling is possible from a minimally or a non-invasive alternative like tears or aqueous. Let me show you this quick example. This is a patient with diabetic macular edema. We gave him anti-VEGF. You see that there is response, but the patient was not extremely happy, neither was I. So I pulled up his aqueous from the injection that we had during the first injection that we had collected. If you see, the VEGF levels are rather low, which is why intuitively I shifted this patient to a steroid and see the response. It's fantastic. Now look at this other patient. She's a 56-year-old female. She hates injections. The first thing she does as soon as she walks into my clinic is, "Doctor, please avoid the number of injections that my friends and family have received." So this is her biomarker profile. You would say that based on this, a steroid is preferable. So that's what we did, and look at the response. It's fantastic. The patient was extremely happy. Now imagine this situation, that the same biomarker profile you can get even before her first injection, and that too from her tears or her blood. She would have been super happy. On the day of the testing, she comes, we check her biomarker, we give her something that she will respond better to. It could be an anti-VEGF, it could be a steroid, and then the patient would just respond fantastically at the word go. So friends, the future is very, very bright. We have a non-invasive and a repetitive biomarker that can not only monitor progression for our patients, but it can offer personalized therapy. We are on the brink of bespoke or personalized ophthalmology, dear friends. And with that thought, I'd like to end my talk. I acknowledge my entire team for this work, and thank you, judges, for your patience here. Yes, ma'am.
You have given a list of biomarkers, right?
Yes, ma'am.
Which among them is a take-home message for us?
This, ma'am, this list. This is the one that we saw a strong correlation with. So, and if you see, most of them are already drug targets, clinically relevant.
Biomarker that will translate into the
Yes, ma'am.
prognosis of the patient, which one would you suggest?
I would suggest VEGF predominantly because that's what we have most experience in. And with VEGF, we've been able to already quantify, ma'am, in the different 4 samples. Whereas the others, the quantification process is still ongoing. So currently, yes, VEGF, and then the pro-inflammatory biomarkers, that is the IL-6, IL-8.
And in the past, you have used vitreous, aqueous, serum and tears.
Yes, ma'am.
And which specimen would you prefer?
So based on this study, we saw the highest of 80% between aqueous and vitreous, ma'am, because they are more, closely related, and then with the tears.
You did the study on all patients undergoing a
Diabetic
vitrectomy.
vitrectomy, so
Diabetic
22
vitrectomy.
patients.
And you then extrapolated the findings to help patients who are not undergoing vitrectomy.
Yes,
like
sir, only for the injections.
For the injections.
Yes.
Okay.
We wanted to make sure that what we are seeing in the aqueous actually reflects what is seen in the vitreous because that's the most important.
Okay. Thank you.
Thank you.